me take a moment and thank you all for being here to listen to me talk. I know it's kind of an unconventional thing, considering, not exactly what you guys are planning to do today, but I appreciate it. Thank you. Okay, so we're going to talk about the 3 most common diseases found in the domestic ferret. And first, I'd like you guys to take a moment and to think about, the pets that you have at home. Think about what would you do if they suddenly got sick and you didn't know what to do. Think about, going to the vet and, what are you going to do? And so that's kind of what I'm going to go into today. Kind of hoping that what you're going to get from what I'm saying, even though I'm being very specific talking about ferrets, a lot of what I'm talking about is also relevant to other animals as well. And I've owned, many pets in the past, but since I don't really have time to talk about every animal, we're talking about ferrets. So the 3 diseases that I'm going to be talking about today are insulinoma, adrenal disease, and lymphoma. So basically, insulinoma is a disease of the pancreas. It causes an increase in insulin and causes tumors and makes the ferret kind of have symptoms of hypoglycemia. Adrenal disease it affects the adrenal gland and it causes it to enlarge and get tumors. And then we go into lymphoma, which is a cancer, which affects the lymphatic system. So now I'm going to get a little bit more technical about each one. Okay, so we're going to start with insulinoma. According to an article by Dr. Ron Himes, the cause of insulinoma is when the pancreas has an increase in overproduction of beta cells. There we go. It's an overproduction of beta cells, which causes a mass production of insulin, and it causes the ferret to exhibit symptoms of hypoglycemia. And over time, if left untreated, your ferret could start going into seizures. He's going to start losing a lot of weight, start being really tired. Your basic person who has diabetes is really going to start showing a lot of symptoms of that. Which, as you can see on here, I kind of outlined what to look for. And this is a little image showing what the little tumors are on the pancreas that are causing this problem. Now we're going to go into some treatment options. Basically, if you start doing these treatments, you can increase your ferret's life by 2 to 3 years on average. Some of the most common treatments are the use of medications to treat the hypoglycemia, or you can use surgery to remove the tumors. The main differences between the two is the medication has lower risk factors, because you're just medicating it, whereas surgery, they have to go get put to sleep and get cut open, so there's a lot of risk factors with that. So depending on how old your ferret is, it could potentially cause more issues than it's worth, which is why it's really best not to just do online research and go off of that. It's best to listen to what your vet says, because bottom line, they deal with this every day and not every case is the same. Now we're going to move on to adrenal disease. Adrenal disease, like I said, is tumors and enlargement of the adrenal gland. One of the most common symptoms of it is hair loss. It's usually the first sign. You start seeing baldness at the base of the tail, and eventually, if left untreated, your entire ferret will become bald. You look like a little cancer patient, not very cute. And then, of course, you have the loss of appetite and the loss of energy, and the loss of appetite does cause rapid weight loss because, ferrets, considering their lifespan is only about 7 or 8 years, not eating for 2 days is going to cause some serious weight loss. So it's something to really keep track on. Now we're going to get into a little image here. This is the adrenal gland. You have a right and a left, and usually the tumors and problems happen on the left gland. They're not really sure why, but according to Dr. Bruce Williams and Dr. Ron Himes, they're believing that this problem comes from them neutering ferrets at such a young age, because when they're bred at Marshall's, usually, they get neutered within weeks of age, and they seem to think that that's where the problem comes from. Okay, so now we're going to go into some treatment options. Again, there's medications, and the medications will regulate the pituitary cycles, and which will help regulate your ferret's internal system as a whole. It's also going to start getting that hair to grow back, which for a lot of people that's enough, because like I said, a lot of people don't want to go into surgery, even though it can actually stop the disease from progressing totally. It has a lot of risk factors. So if your ferret is old, you know, you could potentially kill it just by taking it into surgery. So a lot of people just stick to doing medications. Or, as in recent years, they start using the implants, the grossolorian implants, which a lot of the ferret professionals that I've talked to actually use that. And it's just an implant that they put in the gland, and then they pair it with shots that you have to do every 4 to 6 months, which it can be kind of a pain to have to go every 4 to 6 months. But it's also a cheaper option, I've noticed, with a lot of people, so they tend to do that, and it does really well to expand the livelihood of your ferret. And adrenal disease is also one of those diseases that's not exactly consistent with every case. Some progress faster than others. So again, you want to consult your vet and to what they think is the best option, because not every case is the same. You know, and if you have a younger ferret, they might do better with surgery, and it might actually fix your ferret and give you his entire lifespan. So it really depends on what your doctor thinks is the best option. Now we're going to talk about the cancer, which this cancer also causes tumors, but it's a cancer of the white blood cells, and it attacks the entire lymphatic system. But it's a very slow progressing cancer. And according to Michael Jank, which is another veterinary professional, he seems to have noticed that it usually affects older ferrets, and it also usually affects the internal organs, which is usually what ends up killing the ferret, not so much the tumors themselves. But then also upon reading an article by Dr. Ron Himes, which I know he used his name a lot, he has a lot of very, very in-depth articles about several ferret diseases. He was talking about lymphoma, and the one concern that he has with it, and what many people have seen with it, is that the symptoms of it in the beginning are very vague. And a lot of times it gets pinned on something else instead of people going, oh, your ferret has lymphoma. They think, oh, well, maybe you should change his appetite, or maybe he's depressed over a bedding change. I mean, a lot of people, they pin it on something small when it's usually something big. So usually lymphoma isn't discovered until later stages, where you start noticing those bumps, those enlarged lymph nodes under the fur. You start noticing, oh, my ferret isn't eating as much. Oh, my ferret is acting weird. And so that's usually when they start noticing what it is that's causing it. But in the worst case scenario, you start having that organ failure, because those tumors start causing an internal shutdown. And usually it's the liver that gets affected before anything else, but like I said, that's very worst case scenario, and it's a very slow progressing disease, so most people are able to get many, many years out of their ferret, even if it has lymphoma, yes. And this is a nice little animation showing, you know, the enlarged lymph nodes, the little tumors on the spleen in this case. This is usually where they're usually found when you start noticing them. It's right here under the armpits and up here around the neck. Okay, so let's talk about some treatment options. And like I was saying before, because it's very slow progressing, some people choose not to treat it at all. If their ferret is already older, they choose not to do anything because sometimes it's better than treating it. So as you can see, really the only treatment options for it are corticosteroids and chemotherapy, which it's, as you've probably seen in humans, chemotherapy is very, very hard on the body. So, like I said, a lot of people choose to just not treat it at all because it usually happens in the more senile ferrets anyway. So they figure, let it live its life. And plus with lymphoma, which is kind of unusual compared to the other ones, it doesn't seem to cause the ferret pain in most cases. Like they'll have the enlarged lymph nodes, but it doesn't really seem to bother them. It's really only when it starts causing that organ failure that it starts to really be a problem. And most ferrets usually, ferret parents will put their ferrets to sleep at that point. Because, you know, it's really the best thing you can do for it. But again, it's another case-by-case scenario. It's something that you want to talk to your vet about. It's something that, you know, you want to do your own research, maybe even get a second opinion to decide what's the best idea for your pet. But that pretty much concludes the three. I know I went over a lot of information in a little bit of time there. But basically, the main things to remember, the insulinoma makes your ferret have hypoglycemia, starts exhibiting signs of low blood sugar, and is usually treated by medications and sometimes surgery. Lymphoma causes, or adrenal disease, Adrenal disease causes hair loss, which that one's usually the most quickly found out disease because you start noticing that hair loss immediately. That one, again, treated by medication, surgery, or implants. Then you have the lymphoma, which is the cancer. Very slow progressing, causes tumors in the lymphatic system, and is usually treated by corticosteroids or chemotherapy. Now, again, like I stated in the beginning, I know that my speech was very ferret central, but as you can tell by what I'm saying, a lot of what I went over is stuff that also affects other animals such as dogs and cats, which are the more common pets that people have. So I'm hoping that you're able to get something out of what I went over today. Just never be afraid to do your own research on your pet's condition, but always remember that you should seek professional consultation, even a second consultation if you feel like they don't know what they're talking about. Because I mean, there are some vets out there that, let's be honest, they can be a little out there. So, do you have any questions? Anything? Nothing at all?